Dr. Harika Surapaneni, Director, Dr. Harika ENT Care Hospitals, Hyderabad. So today we'll discuss about middle ear infections. So what is middle ear? Ear is divided into three parts: external ear, middle ear and inner ear. The middle ear is present inside of the eardrum. So this area, this middle ear, is connected to the nose through a tube called as eustachian tube. That is the reason why whenever we have severe nasal infections like common cold or sinusitis, the infection may spread through this tube, eustachian tube, to the middle ear. That's when we have middle ear infections. So most commonly we have acute otitis media, which can be seen as an acute infection, that is immediately after a nasal infection the ear also gets infected. That's when we call it as acute otitis media. And a chronic otitis media, when these acute otitis media we don't treat it on time and they keep recurring, these infections keep recurring because of not taking treatment on time, or if we neglect these symptoms, and such conditions can land up in chronic otitis media. So what is acute otitis media? Acute otitis media is a condition usually seen in children, can also be seen in adults, but usually happens because of a nasal infection. So whenever we have a severe attack of cold, or if this cold converts into sinusitis, acute sinusitis, these symptoms should not be neglected and should be treated immediately. If it is not treated immediately, then this infection from the nasal cavity can transfer to the middle ear, and here the mucosa inside the middle ear gets inflamed, and there will be fluid collection inside this middle ear. Usually this middle ear is filled with air, but when these infections happen, the middle ear gets filled with the fluid. It can be purulent, it can be pus or a mucoid discharge, and sometimes when the fluid the volume of the fluid increases, then the eardrum ruptures and the fluid comes out. That's when we see ear discharge, blood stained ear discharge. Even in children, when they have a lot of cold, they complain of ear pain, after which they have blood stained ear discharge from the ear. So this, when treated on time, there is nothing to worry about. This will be cured when given antibiotics and nasal decongestants. These infections will be cured immediately, and there won't be any further complications for this acute otitis media if treated on time. But when these infections are neglected and there is a recurrent symptoms happening in the because of the infections in the middle ear, this perforation in the eardrum becomes permanent, and there will be a connection between the external environment to the middle ear because of the perforation in the eardrum. So these, when this perforation happens in the eardrum, whenever there is a water entry into the ear, or whenever there is again any infections in the nose, all these will affect the middle ear, and continuously they will keep having ear discharge and ear pain and decreased hearing. Okay, all these symptoms will be seen because of chronic otitis media. So if this acute otitis media is not treated on time, we'll be landing up in chronic otitis media, and the treatment for chronic otitis media is to get a surgery done and close the perforation which has happened in the eardrum. So that is the reason why whenever there is a ear discharge, immediately consult your nearest ENT specialist and get it treated immediately, so that it is not converted into any chronic condition and land up in any complications.